This is a head and neck assessment. First, I will wash my hands and warm them. I'm going to start by inspecting the hair, and I note that the hair looks healthy and there are no signs of thinning. I'm next going to note that the face is symmetrical. Smile. Stick your tongue out. I see symmetry in the eyebrows, symmetry with the eyes. I'm going to palpate the temporal arteries. Pulse feels really good. I'm going to listen for a bruit at the temporal artery. I don't hear a bruit at the temporal artery. I also want to feel the different lymph nodes. I'm first feeling for the suboccipital nodes in the back of the head. Those feel symmetrical and good. I'm next palpating the post-auricular nodes. And then just a little further up here at the base of the jaw is the tonsillar nodes. In front of the ears is the pre-auricular nodes. These are symmetrical and don't seem to be swollen or anything. I'm then going to palpate the submandibular nodes. And then here under the chin is the submental nodes. And that feels good. I'm going to inspect the neck for symmetry and alignment of the thyroid swallow. And that looks good there. And I'm going to palpate the carotid pulse, which feels good. I will listen for a bruit in the carotid. Oh, I'm so sorry. Okay. So we'll listen right here for a bruit. Sounds good. I do not hear a bruit in the carotid. I am going to inspect the ears with the otoscope. So I'm just going to turn that on and pull the pinna. Take a look and see the cone of light in the eardrum. Looks great. And the same with this eardrum here. Looks wonderful. A little bit extra cerumen in the right ear. I'm going to use my pen light and inspect the pupils and the eyes. Once I find my pen light, I will use the pen light part of my otoscope here. Okay, so I want you to look right at me. I'm going to check and make sure the pupils are equally dilating. So you're just going to continue to look right at me. Good. The pupils are equally dilating. Okay. So I'm also going to use my pen light and inspect the nose. I want to palpate the sinuses first. Any pain or tenderness in the sinuses? No. Okay. Now I'm going to view the sinuses. No redness, no tenderness. Everything looks good there. I'm also going to assess the mouth. So I would like you to open your mouth. And I don't have a tongue blade, but we will suppose that I do. And I'm looking to see that everything is symmetrical. Lift the tongue up, looking for lesions, no lesions noted. I see fillings, but no active dental caries. Okay, everything looks good there. I will also inspect range of motion in the head and neck. Touch your ear to your shoulder. Touch your ear to your other shoulder. Okay. And now let's check on the jaw. Open your jaw wide. Close it. Open again. And close it. There's a clicking in the left side of the jaw. Tilt your head all the way back and now forward. Okay. And lastly, I am inspecting the hair on the face, noting that it's evenly distributed. Everything looks good. There is some slight rosacea on the cheeks, which we spoke about earlier. You're already aware that you have a little bit of rosacea on the cheeks. All in all, everything looks really good, symmetrical, even. The lips are full, moist nasal mucosa, moist oral mucosa. Everything looks really good. So we're just going to assess the eyes a bit further. I've washed my hands. I'm going to apply gloves, and we're going to check out the conjunctiva, the sclera a little further, and just make sure that your overall eye health is good. Okay, excuse me. Look up. Okay, conjunctiva looks good. Sclera looks good. Okay. Look up with your eyes. Look down. Okay. There's no lag in the ocular muscles. There's no periorbital edema noted. Okay. And now I'll just have you follow my finger. Okay, the eyes are equal. They follow well. Okay, everything looks really good with the eyes. And that's just a little bit further assessment of the eye health. Okay, so in closure, your whole head looks great. Everything, your neck, your mouth, your eyes, your ears, your nose, everything is symmetrical and looks wonderful. Do you have any questions or any issues that you'd like to share?
No, I do not.
Are you having any problems with anything located above the neck? Any headaches? Anything?
No, I haven't.
Okay. All right, great. Thank you so much for allowing me to assess you today.
Thank you.